Hello everybody and welcome to Go With Us to EULAR 2025. My name is Leila and I am the Health Education Manager here at AiArthritis, and I am super excited to report back on the CAR T cell therapy session that I went to on day one. Or it's not just CAR T cells, but cell therapy in general. They're changing the language, saying that there's other cells that they are able to do this therapy for, and a lot of research going into these new types of therapies that are coming out. And there's lots of promising data showing that there can be long-term drug-free remission. This all started in the cancer space, and this has been a really hot topic for autoimmune diseases and the rheumatic space in general. Being able to transfer this novel therapy into our space that came originally from cancer, and that's how a lot of drugs for AiArthritis disease actually start, is from cancer and being able to control cancer and then trying to therefore switch it over to the autoimmune side. And so I have my notes on my phone so that I know what I'm talking about and making sure I don't miss anything. So I'm just going to be looking at this to give me some of my notes. And so I already mentioned that it all started in cancer. And so now that these trials and there's been lots of success in the cancer space, there has actually even been someone that they had shown a picture of that was a cancer patient who was in complete remission for over 10 years, and they even went to the point of saying that it was cured. And so right now, the space that they are doing most of the testing in the autoimmune space is with lupus, systemic sclerosis or scleroderma, as well as myositis. And lupus and systemic sclerosis are both AiArthritis diseases, but myositis is not. It is closely related, but has to do more with the muscles than it has to do with joints. And so this is a really interesting type of therapy, and we've talked about it in different Go With Us to conferences in 2024, but even in just a year, there's been so much new research that is here to present. And what is CAR T cell therapy or cell therapy in general? It is a treatment where they are able to take your cells and infuse you with engineered version of your own cells to basically reset your immune system and put it into a state that is no longer fighting itself. And so now it's been known to be a pretty invasive treatment because they have to really keep an eye on you because they're basically resetting your whole immune system. What we've seen is patients go in and get their B cells depleted. So they go through a round of a chemotherapy drug to get their B cells depleted, and then they get their cells taken from their body. It's engineered and then put back into your own body and infused just once, and then they would keep you in the hospital for 2 weeks for observation just to make sure nothing goes wrong. So it's a very long process, and during that B cell depletion phase and when they're engineering your cells, you have to wait for that, and you're in a state where your immune system is very compromised, so you can't do much. So it's about a 6-week process that can take a long time. But what's really cool now is that they're finding that they can create this therapy, you don't have to do it from your own cells, that they can have donor cells that they are creating to infuse you with so that you don't have to wait so long to be able to give those re-engineered cells back into your body. And so that is one of the things that they talked about a lot yesterday. And so this is called allogenic or off-the-shelf CAR T cells, and it's manufactured from donor T cells and can be pre-prepared and stored. It's also potentially cheaper and faster to administer because you don't have to go through the personalized engineering, easier to mass produce, and it can be used off the shelf for multiple patients. So this is a really big thing that they are seeing. When we were just at ACR in November, we got a whole presentation on how CAR T cell therapy works. And so this is amazing to see that they are already coming up with ways to make this more accessible to patients, make it affordable, make it so that insurances will be able to pay for it. Because as it stands right now, way too expensive, only available in clinical trial form. And just being able to see the progress of this over the past year has been amazing. And but like I said, it's a single infusion treatment and has potential for drug-free remission. There has been one patient that they also presented that was a lupus patient who has been in drug-free remission for 4 years already. And so they definitely won't get to the point just yet where they can say that it's a cure, but long-term drug-free remission is an amazing endpoint and an amazing place to be, where it's almost even close to being a cure. But we are going to still continue to see what happens over the next few years for these patients that have gotten the clinical trials and have gone through the CAR T-cell therapy. And yeah, it's really an amazing novel treatment to see how much science has evolved in the past years. And so there are some safety considerations when thinking about CAR T-cell therapy. And there is something called cytokine release syndrome that can happen, that if your body reacts negatively to the infused cells. There also could be local inflammatory reactions like a rash or things like that, but usually can be easily taken care of. And there also could be potential for short-term corticosteroid use to calm down the inflammation in the body as the treatment is going on. But they all seem like pretty mild safety considerations when talking about this therapy. The benefits of the therapy is that it can penetrate cold tissues. There's rapid B cell recuperation. So even though the B cells do get depleted to be able to reset the immune system, the B cells are able to recuperate and recover and become active and protective really fast afterwards. And yeah, it has the highest potential to reset the immune system. Just because you get the B cell depletion and the CAR T cell infusion, the hope is for your immune system to be reset. And we have seen that happen, but there have been very few where it still helped, but not have maybe done a full reset of the immune system. But it has significantly improved how many medications you have to take or how much day-to-day symptoms you may have. So even if a full autoimmune reset or immune system reset is not completed, there is still significant change and significant improvement to day-to-day life than there was before. And let's see. The last thing that is really important for all of you all is that they are also looking to expand to other autoimmune conditions as soon as possible. One of the ones that they mentioned is ITP, or immunothrombocytopenia. It's actually a low platelet autoimmune disease where it causes low platelets. And that's actually something that I had when I was 8 years old that is seen now to be a precursor to lupus. So that's really cool for me to see that there's new therapies for that as well. And hopefully very soon it will move into other AiArthritis diseases. I don't see why it wouldn't work for these other diseases. It's just really making sure, getting the mechanisms to see that it will work in those other disease states. Super excited over the next few years to see where this goes. It currently, like I said, is with systemic sclerosis, lupus, and myositis, but very soon they look to expand to the other autoimmune diseases and autoinflammatory diseases. And last thing is like the limitations of this. It's very complex and very extensive, like I said before, so it's not something that's easily accessible. It's not a guaranteed permanent cure, but there is potential for it, like I said, to significantly improve your day-to-day life and symptoms. And there's lots and lots of ongoing research to see how this is going to continue to help AiArthritis patients, the AiArthritis community, and all other patients that are experiencing different autoimmune diseases like these. Like always, so many amazing new research and new discoveries at these different conferences that we go to. And here at EULAR 2025, CAR T is a really big theme, as well as there's a lot of other new treatments on the horizon. I just wanted to do a whole session or a whole video talking about this specific session because it was so in-depth and so interesting to be able to talk about CAR T-cell therapy. I also wanted to thank Bristol Myers Squibb for sponsoring our Go With Us program and allowing us to be able to talk about CAR T-cell therapy to all of our patients and all of our community and let them learn how this therapy can really improve the lives of patients, hopefully here in the next 10 years, if not sooner. So thank you again to Bristol Myers Squibb for sponsoring our Go With Us program. And thank you all for listening, and I look forward to reporting back to you on day 2 of EULAR 2025. Alrighty, bye-bye.